My name is Laura Smith, and I'm president of Nova Healthcare, and I am here to talk to you probably about one of your most favorite subjects, right? Healthcare. What I really wanted to go through today was kind of talk about some of the challenges that I think all of you are facing with healthcare and the escalating costs, some of the opportunities where there's options to help you reduce some of your costs or save dollars, what some of the benefits of those cost-saving opportunities are around self-funding, some of the risks potentially associated with self-funding, and then probably one of the questions that you're going to have at the end is, how do you know if self-funding is right for you? So we're going to kind of talk about that, and if you are a good candidate for self-funding, then how do you choose the right TPA partner? How many are any of you self-funded today? No? Has anybody ever considered self-funding? Okay. All right. All right, so kind of to level set, I thought we would talk about some of the challenges that all of us really that are running a business are experiencing with healthcare. Over the last 10 years, we all know that healthcare costs have increased. According to a Kaiser study that was done last year, the total premium cost of healthcare has increased 97% over the last 10 years. And some of the factors that are contributing to that, there's two different ways to look at them. Some are uncontrollable. So aging population, new medical technology, federal mandates, healthcare reform, all of the new taxes that are going to be associated with that. Those are some of the factors that nobody can really control. But what I want to help you focus on today are the controllable factors. And those are increased utilization and consumer spend, increased pharmaceutical spend, all the commercials that you see. Individuals are now more aware of some of the new technology that's out there, the pharmaceutical drugs, and they're asking for more and more services. Unhealthy behaviors and lack of consumerism. That's another opportunity, I think, where there's an opportunity to save, is helping people to change their behaviors. I just recently read an article that talked about that there are 8 behaviors that actually contribute to 15 chronic, our most common chronic conditions. And those 15 conditions actually account for 80% of the cost of taking care of those chronic conditions. So there's 15 behaviors that if we can actually start to try to control those behaviors or change those behaviors, if we can change just 3 of them, there's a study that shows that you can save up to $700 per employee per year in just trying to start to change behaviors. And when you're self-funded, you actually get to reap the benefits of that, not the insurance company. So just like healthcare costs have increased over the last 10 years, so has the prevalence of self-funding. So this is another study by Kaiser that just shows the increase of self-funding over the last 10 years. And as you can see, if you have 1,000 or more employees, 78% of the employees that are working for companies that have 1,000 or more are covered under a self-funded plan. 52% are in the 200 to 999, and I think some of you would be surprised to see that 15% of the workers that work for companies under 200 are also self-funded. Because a lot of people, they think that they may be too small to self-fund if they're under 100 employee lives, but more and more companies, the number of employers that have less than 100 lives are actually starting to increase self-funding. All right, so what is self-funding? Real quick, an overview. So fully insured, I think everybody's aware. You pay a premium to the insurance company takes on all of the risk, and any savings that there may be from people changing their behaviors or through discount negotiations, the insurance company is actually they're the ones that are saving, because you're going to pay a fixed cost to them regardless of what the actual cost of that care is. When you're self-funded, you as the employer assume the majority of the risk for the claims and the administrative cost. But you purchase what's called StopLoss Insurance, and I'm going to go into that in a little bit more detail, and that protects you against catastrophic loss. And typically when you're self-funded, you contract with an administrator to handle all of the administration, the claims, the customer service, the medical management component. But when you're self-funded, any savings belongs to you at the end of the plan year. Okay, so here's what I really wanted to talk about is where does your dollar go when you're fully insured versus self-funded? So we tried to show you on the fully insured side, if you look at every dollar that you spend for your health care coverage, 80% of that dollar is typically applied towards the claims. The other 20% goes towards the administration as well as all of the taxes. So New York State, as an example, has a 1.75% premium tax that's associated with your fully insured plan. Now under new healthcare reform and PACA, there's a couple new taxes that are going to be applied. I think one is, it's a health insurance tax, and it's going to be assessed to all insurance companies based on the amount of market share that they have and their size and their demographics. But they're estimating that the cost of your fully insured premium is going to go up about 5% just for taxes alone to fund the healthcare reform, some of the initiatives that they have. The tax that I'm talking about is particular so that there's a fund or a reserve that's built for those individuals that have been uninsured and now are going to require insurance and have pre-existing conditions. So it's there to kind of protect the insurance companies. On the self-funded side, we're going to assume for a minute that the claims are equal. So if the claims were equal, the administrative costs for the stop-loss protection that I talked about for the catastrophic losses, that's about 9%. So 9% of your dollar goes towards your stop-loss protection, and about 6% covers the administrative costs as well as some of the taxes. And a lot of the state taxes, under self-funded plan, it's ERISA exempt, so there are no state taxes or state mandates. So anything that a state imposes on an insurance company, the self-funded plan is exempt from that. So there's some immediate savings there. Yes? That's called stop-loss insurance. It's catastrophic protection. And I'm going to go into that in more detail. Oh, yeah. Could you pay him for... No, I didn't. Yep. No, I'm going to go into that. So just moving to a self-funded plan without doing anything else to start to manage the actual claim costs, there's a savings there of about 5%. So if you look at, let's say if you're a 300 employee life company, right, I'm going to just kind of estimate about $10,000 per employee per year is kind of an average of what the costs are today for coverage. So 5%, just moving to a self-funded plan is about $150,000 savings on a $3 million healthcare spend. So just by moving to a self-funded plan, which then there's so many other benefits to it, which I'm going to go into. I kind of want to just show you the difference on the administrative side. So that 20% of your dollar that you're paying to an insurance company, that's going towards their overhead. So if you think of the large insurance companies and think about the overhead that dollar has to cover, their direct costs for their employees, the pooling charge, so there is a stop loss or a reinsurance fee that's built into your fully insurance policy as well. The premium tax that I talked about, 1.75 for New York. Reserves, so insurance companies build in a percentage, it's typically 3 to 4% for their reserves, because they need to continue to keep reserves in the case of, there's a catastrophic situation that occurs with their plan. And then there's the profit margin that's built in. On the self-funded side, the administration is covering for a third-party claims administrator to process your claims, to answer the calls, for the medical management. You're typically accessing a PPO network so that there's a group of providers, hospital systems, and physicians that you're contracting with for discounts. and then the financial and clinical reporting. But it's a much smaller number when you're self-funded than the 20% that you're paying to the insurance company. Okay, so let's talk about the 80%, which to me, this is the most important. You know, this is 80% of your dollar, and how are we going to start? How can you start to manage that? All right, so we're going to kind of talk about a formula to help you stretch your dollar. Where you're really going to have an opportunity to save on your health plan is by implementing population health management, cost containment strategies, and creative plan designs. And one of the things, again, when you're fully insured, anything that you do to help improve the health of your population or to help manage the costs, it's the insurance company that's going to reap the benefits of that. Right? So you can do all the great things in the world, and there, at the end of the day, your claim costs, when they go down, that's more profit for the insurance company. And when has anybody ever had a decrease in premium? You have.
In the last 5 years, I've had 4 years of decrease, but we're on an HSA plan.
So it's plan design.
Yep.
So it's plan design. So it's really not a decrease in costs. It's more of a cost shifting towards because you're implementing a higher.
Our medical loss ratio decreased. Now we had one very large claim, which I know Blue Cross Blue Shield had StopLoss for. We
Right.
still got punished for it.
Right.
But we really saw a decrease in our overall claims experience as well.
Because of the high deductible plan and promoting consumerism.
And high deductible plan, but I think it also forced our employees. We tried to teach the employees to say, hey, if you need a CAT scan, don't necessarily go to the hospital. Just take 4 times as much for a CAT
Yep.
scan. So go to the standalone clinic.
Yep.
And you'll pay $400 versus $1,600.
Yep. So that's one of the controllable factors that I talked about was the utilization. This is the one area where we're asking people to be consumers typically, and they have no idea what things cost. It's like going to a restaurant, right, and getting a menu without any prices on it. You're going to order, and if you're not paying for it, right, you're all here for work, right? So took out your credit card. If you're not paying for it, you typically really don't ask about the cost of things. So, you make a great point. It's the increased deductible and having them be better consumers. So, and that's really what a lot of this is about. So when you're self-funded and you start to implement these types of programs, you start to promote consumerism, you start to promote better, behaviors, you're looking at your population. What you should really do is kind of look at your population in 4 different categories, right? So you have your individuals who have no risk, they're healthy. Then you have those that are low risk. Those you really want to make sure that you're working with those individuals to keep them in the low risk category and trying to get your moderate risk and your high risk to either manage the claims that they're already incurring and start to help them to change their behavior so that they fall more into a low risk or a no risk. And this is where when you engage with medical management and you have nurses and health coaches working with the individuals, again, when you're self-funded, any procedure that you avoid as a result of helping people quit smoking or start exercising, those are dollars that are going to drop to your bottom line, not the insurance companies. And then the same thing goes on the cost management side. So when we talk about the population management, that's more proactive, more trying to help people engage in healthier behaviors, changing the way that they take care of themselves, making sure that they have their routine visits, that they're getting their checkups, that they're eating healthy. That's all proactive. On the cost management side, what you really want to focus on is the actual claims that are coming in, and then what type of strategies do you employ to help reduce the costs there. So again, kind of breaking the claims into 4 different categories. So you want to look at, you're going to have 4 different types of claims. You're going to have those that are necessary. So those you want people to have their routine visits. You want people to go to the doctor if they're sick and have their routine blood work and x-rays. So what are you going to do in order to help reduce the cost there, that's where you have your PPO discounts. You have, you're going to encourage prevention. You want people to take responsibility, personal health management. You want to encourage them to have those services. Discretionary, those are the types of services where people have a choice. So talking about the CAT scan, do they really need that CAT scan? You want to give them information. We want to educate them and help them be able to make good decisions as healthcare consumers. Another area with discretionary services are prescription drugs. Do they really need that brand name drug? Or can they use the generic alternative? Emergency room visits versus urgent care. A big area that you want to focus on with your plan if you're self-funded is making sure that your employees and their family members have primary care physicians. That's one of the biggest reasons for emergency room use. So you have that population of people that are like in their 20s. They age out of pediatric care, and I'm sure most of you are aware that there's a huge there's not a lot of PCPs, not a lot of primary care physicians. That particular, I don't even want to call it a specialty, but most of the individuals coming out of a school are choosing to go into specialty care. They don't want to be a primary care physician. So there's a shortage of PCPs. So when they age out of pediatric care, they don't have a primary care physician to go to. When you don't have a PCP and you get a sore throat or you're sick, you're not going to be able to go to a doctor. So you have no choice but to go to the emergency room or an urgent care facility. So one of the things that, again, when you're self-funded, you really want to focus on making sure that all of your plan participants have a primary care physician, because that will help to keep your costs down as well. The high cost unavoidable is another category. So these are the claims that are incurred from accidental injuries, things that you can't avoid, high-risk pregnancies, cancers that are not necessarily avoidable. So what type of strategies are you going to employ to be able to reduce care here, or reduce costs here, not reduce care, costs? So medical management, you want to make sure that you have nurses, case managers that are working with those individuals, helping guide them through the system, because that's another problem with healthcare today, is individuals, they really don't know how to guide themselves through situations that they have when they have a surgery. What are they supposed to do post-surgery? What are they supposed to look for? Physicians today, they don't have a lot of time to spend with their patients afterward. So you want to make sure that there are nurses helping the individuals manage through the system, and that they're compliant, because that's another issue. I was talking to somebody earlier who said, how many times do you go for you're on an antibiotic and you never stay the course? I don't know, I've been guilty of that, not finishing my antibiotics. So that's just one example of where if people aren't compliant, it's going to increase costs within your plan as well. So you want to make sure that you're helping these individuals stay compliant and helping them, guide them through their treatment. And then the fourth category that is, I think, one of the most important is those high-cost claims that are avoidable. And this goes back to those 15 behaviors that are driving 8 of the most chronic conditions that are really 80% of the costs associated with those conditions. This is where these are costs that should have been avoided if people weren't smoking, if they were active, were working out, if these are the types, if they're taking their medication. So even just being compliant, they may have high cholesterol and there's nothing they can do, but if they continue to take their medication, it's going to keep their cholesterol down and prevent claims and excessive claims from getting incurred at a later date. So when you're self-funded, the big focus is if you can reduce your claims, not reducing the care, because it's actually going to improve the overall care, but reduce the claim costs. When you're self-funded, this is going to increase your bottom line, because these are dollars now. Every single dollar that you save as a self-funded plan goes right to your bottom line. So this kind of just shows when you're fully insured, the carrier is going to take the charges, they're going to apply their discounts. That's what they focus on. I don't know how many of you have talked to some of the big carriers, and they all talk about, well, we have a 50% discount with our providers. Well, one of the things that you want to watch out for, if you are going to move into a self-funded environment and they tell you that they have a 50% discount or a 60% discount, one of the things to make sure that you ask them is, does that discount prevent you then from managing that care? Because oftentimes I've seen with the larger insurance companies, they rely on that discount and in turn have provisions within their contract with the providers that don't allow them to audit the claims, as an example, or to manage the care while that individual's in the hospital. So the hospital, in exchange for that big discount, says, that's fine, I'll give you this discount, but you can't manage what I'm doing. And at the end of the day, if you're able to manage and you can get that person out of the hospital 2 days earlier, that's 100% discount on those 2 days versus somebody who can't manage that care and is taking 50% on those 2 days that that person was left in because they couldn't manage them. So I just want to caution you on network discounts that they sometimes will prohibit you from being able to manage the claims the way that you really need to. So when you're fully insured, your dollar, again, is going to the insurance company, and any savings that they achieve is their savings. When you're self-funded, you apply all of the cost containment, medical management, some of the strategies that I talked about. The first and foremost, you really want to try to avoid as many of the services as possible. Because if you can avoid them, again, like I said, that's 100% discount right off the top. So when you take into account all of the cost containment activities, you have a reduced claims expense, and you really do have increased member satisfaction because you have individuals that are engaging with them and helping them navigate the system. So the big question then becomes for you, as most of you are CFOs in the room, when you implement all of these tactics, you're going to have savings. So every single one of these is taking a slice off of that 80% of the claim. I have to get through it. So everyone is taking a slice off that claim, and it's considered now discretionary spending for you. Those are dollars that are left over that you can keep as a reserve for future healthcare expenses, and we're going to kind of talk about that's a potential challenge with self-funding. So you can start building a reserve for future costs that may be out there. You can use those dollars for capital expenditures that you may, if you're in a manufacturing firm, there might be some equipment that you've wanted to buy. So those dollars would be left over for that, or just other corporate initiatives or expenses. So again, those are your dollars. So when you self-fund between the reduction in administrative fees as well as the cost savings on the claims, the potential that's out there, on average, and I'm going to show you some examples, on average it's about a 20% difference between what you would pay if you were fully insured and what your total expense would be as a self-funded plan. So again, if you go back to that 300 life group that has about a $3 million spend, you're talking about a $600,000, right? You guys are the $600,000 savings by moving to a self-funded plan in that example. And having the right partner to help with the cost containment and the medical management strategies that we talked about. So really, self-funding, it allows you to be creative with your plan designs. So you have the flexibility. Today, when you're fully insured, you have to pick from the menu of plans that the insurance company is offering to you. When you're self-funded, you get to create the plan design that you want. So as an example, we have, there's an employer that wants to promote people taking their medication for cholesterol and high blood pressure and diabetes. So in their plan, they actually have a zero copay for those particular medications. And they've been tracking it, and they've been monitoring the compliance rate for those conditions, and actually they are seeing reduced costs in emergency room and inpatient visits for those particular disease states. So depending on when you're self-funded, you can really start to look at what are your cost drivers. You know, what are the demographics of your population? What are the disease states? Where is the utilization patterns? And you can really start to tailor your plan design, be creative, and tailor it around the needs of your population, and not be restricted to the plan designs that the insurance carrier is offering on a fully insured basis. There's also some companies that are looking at where the majority of their utilization is, let's say from a hospital perspective. So if there's one particular hospital in their area that the majority of their care is provided, negotiating with that or having their TPA partner negotiate with that health system for either better discounts, better care, having coordination with case managers on site. So there's a lot of flexibility and customization that you can apply when you're self-funded. So now I want to talk about some of the concerns or myths that are associated with self-funding. A couple of them are, you know, the first thing I think that people think about is, well, what about high-cost claimants? I could have somebody have $1 million claim and it's going to put my company out of business. So that's where the stop-loss insurance comes into play. And I'm going to go into that in a little bit more detail. And then there are, has anybody ever heard of a laser? You know, that's another concern that organizations have when they think about self-funding. A laser is where it's a known risk. So let's say you have somebody who's on a transplant list. So the stop-loss carrier is going to set a higher deductible for that individual because it's a known risk that's out there. And there are actually benefits to having a laser built into your contract versus having them absorb that through premium increases. Because oftentimes that person never really ends up having that care. So even though it may have been a higher deductible, if the care isn't required, then as the employer you didn't have to pay those dollars out. Inconsistent cash flow. This is another one. So when you're self-funded, you're paying the TPA to administer the plan, but then every month you're paying the actual claim. So one month the claims could be a little bit higher, the next month they're lower. So you have this fluctuation of your claim dollars. Some companies are fine with that and would prefer that because at the end of the day, if they're going to save 20%, they're okay with that. But there are options where you can actually budget a set amount so that you don't necessarily see that fluctuation. Administrative burden is another concern, which that's why you would want to partner with a third-party administrator who would handle all of that work for you, processing the claims, answering the phones, the medical management component. So the concern is that there is more work, but if you partner with the right organization, they really help guide you through that process. And then inability to tolerate risk is another concern, that organizations think that they're too small and that they can't handle the risk, but if you pair it up with the right stop-loss coverage, there is protection for you. So one of the things that I talked about was the high-cost claimants and the inability to budget. When you actually look at claim costs, if you look at kind of an average, most self-funded plans are going to have one bad year out of 4. So this, kind of depicts a typical self-funded plan. In the first year, if you were going to, have a budget of, whatever, let's say it's a $3 million budget. The first year, your claim costs are actually going to come in less than that in this example, right? This is an example. In year 3, though, you have a catastrophic claim, or you have a couple of people that need some major procedures. So in that 3rd year, your claim costs are actually going to be more than what you budgeted. But this is where you talked about, how are you going to use those savings? This is where a lot of companies will actually use those savings as a reserve. Just like the insurance companies take a portion of your premium and they put it aside as a reserve for future claims. That's what most self-funded plans do. So in the first year and the second year, they take a portion of that savings and they kind of set it aside so that in year 3, when the claim costs come in higher, or when they get a laser from the stop-loss carrier, they have those dollars and it's not a concern. And then when you look at, over 4 years, at the end, there's still the significant savings, even though that 1 year might have been higher. Okay? In a fully insured world, that year 3, some would most likely give you a significant increase the following year. And in this example, you really didn't need that in year 4. But the insurance company is going to take that experience and they're going to give you a significant increase because they need to make up some of the dollars that they paid out. All right, so what are some of the ways to mitigate the risk that we talked about? So I've talked a lot about stop-loss coverage or catastrophic coverage, and there's 2 ways that you can protect yourself in a self-funded plan. The first way is what we refer to as specific stop-loss, and this is where you're purchasing insurance coverage to protect against an individual catastrophic loss, right? So in this example, what you typically do is you would buy stop-loss coverage that has a deductible amount. So that 300 life group, as an example, would most likely buy a specific stop-loss policy, maybe with a $60,000 specific deductible, which means that the employer, the self-funded plan, is responsible for all of the expenses up to the $60,000. And then any dollar paid out in excess of that $60,000 for any one particular person is reimbursed by the stop-loss carrier. So it's kind of like what a lot of companies are doing. You're buying now fully insured, higher deductible plans, right? And then you're kind of self-funding the HRA portion. For those of you that have high deductible plans with a health reimbursement account, it's really the same type of concept, just not as significant dollars. So you're buying a $10,000, or I think somebody said earlier, a $3,000 family and a $6,000, or a $3,000 individual and a $6,000 family fully insured policy, and then they were funding $2,000 towards the HRA. You're really self-funding that $2,000. So in this example, you're buying a $60,000 fully insured stop-loss policy, and as the employer, you're funding everything up to that $60,000. And then anything above that is reimbursed by the stop-loss carrier. So that $1 million claim, you're protected. Your organization is protected from that. And then the second type of stop-loss coverage is called aggregate, and this is what protects the entire plan. So the stop-loss carrier, similar to an insurance company, is going to take a look at all of your claims experience, and they're going to build in trend and determine what your expected claims will be for the following year. And then after they determine the expected claims, they build in this 25% corridor. And as a self-funded employer, you're responsible, or would be responsible, for your expected claims and anything that exceeds that in that 25% corridor. And then it's anything above that. If your claims exceed your expected plus 25%, then again, you're protected. The stop-loss carrier is going to pay for everything above and beyond that. So you know going into your plan year what your worst case scenario is, and you can budget for it. There's also, so that's a typical self-funded approach. Year over year, you're purchasing stop-loss coverage and protecting the plan, and you're really only budgeting year over year, which is the case with fully insured plans as well, right? I mean, that's one of the challenges, I think, with healthcare, is that you don't know from one year to the next what your rates are going to be. 90 days before your renewal, you have no idea whether you're going to get a 5% increase, a decrease, right, or a 25% increase, which is what a lot of companies now getting a 20 to 25% increase, especially with healthcare reform and all of the taxes. But you really don't know until you get that renewal. So one of the programs that is now starting to become available is a way for you to take and look at what your next 3 years of health costs will be, of all of your claim costs, and actually spreading it out over 3 years and determining a fixed amount that you would budget for. In year one, you're probably paying a little bit more because you're front loading it a little bit so that you have this fixed cost over the course of the 3 years. And this program also allows you to take those reserves. So you would actually build in how much of reserves do you want? Do you want to build in a 1% reserve, 2% reserve? And it allows you to build those reserves in and then keep those reserves tax-free. Where in a traditional self-funded plan, anything that you save is obviously considered just its ordinary income that drops to your bottom line. So it's taxable. Where in this product, they're tax-free. It also fixes the stop-loss rates so that this really is beneficial for organizations that have collective bargaining agreements, that are dealing with unions where you need to negotiate 3 years out, and it's very hard to when you don't know what your costs are going to be. So you may negotiate in a specific plan design with them, but it's a challenge when you don't know what your increases are going to be. This allows you to have that fixed rate for 3 years. So this kind of gives you an example of how this program works. It's kind of like a mortgage statement, really. You look at it, you come up with your fixed premium equivalent, if you will, that you would be contributing, and then you offset that by the administrative costs, the fixed costs, as well as the claim costs, and you can see you continue to build your reserve. And those can be used to offset future claim costs. You can use those reserves towards wellness programs or other types of, healthcare initiatives. Okay, so I've talked a lot about self-funding, what it is, what some of the advantages are, but the big question is self-funding right for you? And again, a lot of people think that if I don't have 100 employees or 200 employees, or self-funding is really for the big guys, for the big companies. Yes, size does matter. You do definitely need to look at how many employees you have, but that's only really one factor. Some of the other factors that you want to think about are the demographics. Do you have a lot of young, healthy males in your population? Because that's the lowest risk group. Is your company stable? What are the economic conditions that your organization is going to be facing? Is it, you're concerned as to what's going to happen over the next couple of years, and it may not be an ideal time for you to self-fund. What's the cash flow of the organization? What's the risk tolerance of the organization? So there's a lot of different factors that you want to consider, and it's not just, how many employee lives that you have. We have organizations that have as few as 70 employees that are self-funded. Which leads me into my examples. So these are 2 real-life examples. I have 2 organizations, one smaller group, 76 employees. The blue line shows in 2010 what their fully insured rate was, just about, I think, $700,000. They were expected to get I think it was like a 9 or 10% increase, but their demographics were, they were young. Their loss ratio was very good. They had, they didn't have a lot of high-cost claimants. So in 2011, they chose to move to a self-funded plan design. They kept the exact same plan design that they had when they were fully insured for year 1, and they just changed the funding to a self-funded plan. And in year 1, you can see it wasn't really significant savings. It was only 1.2%, or in this case, $8,700. I think they actually ended up having a claim, that they didn't expect in that first year. But in year 2, if they, from 2011 to 2012, that the insurance carrier that they were with, their average increase was, I think, was 9%. So we estimated what their 9%, with a 9% increase where their fully insured premium would have been in 12, compared that to what their actual costs were, and in this case it was 24% less, or a savings of just under $200,000. So, you know, in this example, you would think in year one probably wouldn't be worth self-funding or taking on the risk, but this group has really done a lot to look at what's driving their costs, what programs can they implement, how can they start to really avoid some of those costs in the future and bend their trend, is really what they were doing. This is another example. This is a 300 life group that, same thing, in 2011 moved to self-funding. Their first year, so it's kind of a little bit opposite. Their first year, they actually saved $470,000, or came in at 20% less than what their fully insured premium renewal would have been. And then in year two, it was 10% less with that assumed 9% trend, or still 200, just, you know, $250,000 savings. What, you know, think about what you could do with those dollars. So assuming you think that self-funding is right for you and it makes sense, the next question then is, so how do you select the right TPA partner? What should you be looking for? And I know my pictures are kind of corny. It's my marketing department for you. What this is really meant to show you is that there are a number of different TPA options that start off with a small mom and pop TPAs, very small, probably have high touch service, you know, we'll do pretty much anything that you ask, but they don't have a lot of, you know, the latest technology. They may not have access to compliance officers, you know, may not necessarily be in touch with all of the latest regulations and things like that. On the opposite side, you have your national carriers. So this would be the Blues, United, Aetna, Cigna. These are organizations that are very, very large, do have all of the resources, but the picture is meant to show you that, see how many different rooms there are, that you kind of get lost. You kind of get lost that your claims might be paid in one state and your phone calls are getting answered in another. So there's really, you know, not a lot of good communication that necessarily goes on. Depending on your size, you may be a very small fish in their big ocean and may not have a lot of, you know, opportunity to work with them and really see significant changes to your plan. And then in the middle, you have kind of your mid-size TPAs that really give you the best of both worlds. So they do have access to some of those resources that you need, but yet still are small enough to give you that high-touch service and customization and flexibility that you need. So when you're looking for a TPA partner, we kind of wanted to give you a list of things that you should look for. You know, you want somebody who's dedicated and experienced in self-funded administration, that they're really dedicated to that. I think that's key. I also think you really want somebody that has in-house medical management. So you want the nurses completely integrated with the claims team, with the account management team, because that's critical, as well as the cost management. They all need to be working together and preferably sitting in the same area. You want to make sure that when you interview them that they give you all the details about their cost management strategies. What are they doing? Not just say that they have that they do cost containment or cost management, but ask them, what are they really doing, and have them describe that to you. They should be willing to put performance guarantees in place. And not just, you know, they should be guaranteeing their claims turnaround, customer service, you know, making sure that they're going to provide a high level of member satisfaction. The other thing that you really want to make sure is that they are going to work with you, that they're going to help you analyze your plan, give you insight as to what's driving your costs, and provide solutions. That's key. So just moving, again, to a self-funded plan, sure, you're going to save about 5%, but it's this analysis that you need to really make sure that you understand what's driving your claims, and that you can start implementing programs that are going to help to reduce those costs. And I am getting like this 5-minute warning back there, so. So this kind of just shows why self-funding. We've already talked about some of the benefits. You know, there's increased savings, greater flexibility, more customization, and you know, there's transparency. You know exactly what's driving your costs. So, you know, in the end, what I really hope that I was able to get across is if self-funding makes sense for you, if you have the right TPA partner, you're going to have some significant savings that, again, you're going to actually, you know, have either to build your reserves, to fund some capital projects that you've wanted to do, but there's a lot of opportunity. And it's not just the savings, but it's also improving the health of your employees as well. So, are there any questions? Yes. There's different networks depending on the area. So as an example, in New Jersey, MagnaCare is a PPO network that we utilize. So there's different PPO networks throughout the various states in the country. So we actually look at the population, look at your census, and determine what is the best network for your plan. Yes?
Is there flexibility around that, for instance, if you have a population where there's been some movement and don't want to disrupt the employee base again with switching providers, or are you pretty much set with PPOs?
So, well, if you are using a PPO plan, a PPO that...
So could we stay with that?
Could you self-fund with Aetna? Yes, you could self-fund with Aetna. Aetna does offer a self-funded plan, but that's that big house on the right. No, they do. They do offer a self-funded plan so that you have the same name on the ID card and the same network. You just, again, when you're looking to partner, you want to go through that checklist to make sure that you're getting all of those services. Someone else had a question. Yep.
How is all this affected by the Obama?
So with a lot of companies that are actually considering self-funding because of healthcare reform, there's a lot of taxes that are now part of PACA that insurance companies are going to be burdened with that self-funded plans won't be. So there's some opportunity for savings there with a self-funded plan. But then there's also some of the mandates that regardless of whether you're fully insured or self-funded, both options are going to have to implement. So you can avoid some of the regulation through self-funding. So, yes, Trinity.
You mentioned about claims lost, increased premium in the following year.
Mm-hmm.
What does that look like in a self-funded sector, I guess? I mean, do you expect the same ratio of increase from self-funded versus non-self-funded?
On the trend?
Yeah, you have a bad year, let's say. The following year, do you expect the same ratio of increase, I guess?
So, well, the claims are going to be the claims. So whatever they end up being that following year, we're hoping though that they're managed well with from the nurses, the medical management. But I think, is it the trend that you're talking about on the stop loss? Yes. So the stop loss, it's not as high of an increase, and oftentimes what you're raising your deductible or the risk that you're taking with your stop loss carrier as your claim dollars increase. So you're always trying to keep the deductible at the same kind of percentage of your total healthcare spend. So you're raising your deductible, which is keeping your premium increase down on the stop loss side. I don't know if I've explained that right, but it's not as significant. It's not a 20% increase. I have 1 minute left. Yes.
When you mentioned the tax-free reserve
Mm-hmm.
element of this, is that similar to, in concept, to when you have a captive insurance company? And
Yes.
you pay the premiums to that?
It's similar. It's not a captive, but it is similar. It is similar to a captive, where you are kind of setting up a fund, if you will, for those dollars to sit in. Yep. Yep. And if anybody has any detailed questions, or, you know, you want more information on stop loss, or want to talk about your specific situation, we do have a booth out there that feel free to stop over and have a conversation with us, or pick up one of our business cards. Any other questions before? No? Okay, thank you.